Your tongue is telling on your gut. 6 warning signs most adults ignore. After 50, most people think gut problems should show up in one place only: the belly. They expect bloating, constipation, reflux, diarrhea, pain. So when the first clue shows up on the tongue, they miss it completely. And that is exactly why this topic matters more after 50. The medically honest version is not that your tongue can diagnose your gut by itself. It is that tongue and mouth changes can sometimes act like early clues for reflux, nutrient malabsorption, dry mouth, high blood sugar, yeast overgrowth, or inflammatory digestive patterns that older adults are more likely to deal with. Older adults are also more prone to dry mouth because of medications, dehydration, long-term health conditions, and age-related changes in how the body handles medicine. So if your tongue has been looking, feeling, or tasting different, stay with me, because I want to walk you through 6 warning signs most adults ignore after 50. Not 6 diagnoses, 6 clues. And the first thing to understand is this: the tongue often reflects what is happening with moisture, nutrition, inflammation, and reflux long before people connect those changes back to digestion. A pale, smooth tongue, a burning tongue, white patches, dry cracking, or a sour taste are not random cosmetic issues. In the right context, they can be part of a much bigger metabolic or digestive story. The first sign is a persistent sour or bitter taste, especially in the morning or after lying down. This is where the gut-tongue connection becomes more obvious than people expect. NIDDK lists regurgitation among the classic symptoms of GR and GERD, and reflux can reach high enough to leave a sour or bitter taste in the mouth. Oral health reviews also report that symptomatic GERD is associated with more halitosis and other oral complaints in some patients. So when someone says, "My tongue tastes off all the time," that is not always a tongue problem. Sometimes it is the upper digestive tract, quietly reaching the mouth. The second sign is a smooth, pale, or oddly glossy tongue. Most people do not realize this can be a nutrition clue. Merck says a pale, smooth tongue can happen with iron deficiency or vitamin B12 deficiency, and a smooth, red, painful tongue can occur with glossitis. That matters because digestive disorders can cause these deficiencies by interfering with absorption. Mayo notes that celiac disease can cause anemia from decreased iron absorption, and NIDDK says celiac disease can damage the small intestine and keep the body from getting the nutrients it needs. NIDDK also notes that H. pylori gastritis and autoimmune gastritis can interfere with iron and vitamin B12 absorption. So a smooth, shiny tongue is one of those subtle signs that may look mouth-related, while actually pointing to a stomach, small intestine, or malabsorption problem. The third sign is a burning tongue, especially when no obvious sore or injury explains it. This is where people get fooled because they assume burning means irritation from food alone. But Mayo and Merck both note that burning mouth or tongue symptoms can be linked to dry mouth, low vitamin levels, reflux, or nutritional deficiencies such as iron or B vitamins. That is important after 50 because vitamin B12 deficiency becomes more relevant with age, and Mayo says older adults, people with stomach surgery, and people with digestive conditions such as celiac disease or Crohn's disease are at higher risk because they may not absorb B12 well. So if the tongue burns and nothing obvious is there, the smarter question is not just what did I eat, but also what am I failing to absorb. The fourth sign is a thick white coating or white patches that do not look normal. Now I want to be careful here because a coated tongue can happen for simple reasons too, including dryness and oral hygiene issues. But raised white patches that look like cottage cheese or a persistent white overgrowth can point to oral thrush. Cleveland Clinic describes thrush as a yeast infection that can create white raised lesions on the tongue and inside the mouth. Cleveland Clinic also notes that people with diabetes, especially when glucose is not well controlled, are more prone to oral yeast problems because Candida thrives on the higher glucose levels in saliva, and dry mouth increases that risk. So a white tongue does not automatically mean gut fungus, but it can be a clue that your glucose control, antibiotics, moisture balance, or immune state is creating the wrong environment in the mouth. The fifth sign is an unusually dry, sticky, or cracked tongue and mouth. This one gets ignored constantly after 50 because people assume it is just part of aging. But NIDCR and Mayo both say dry mouth in older adults is commonly related to medications and dehydration. And Mayo adds that many drugs used for depression, blood pressure, anxiety, allergies, congestion, pain, and other common conditions can cause it. That matters because dry mouth can make chewing and swallowing harder, increase the risk of tooth decay, and make fungal infections more likely. Cleveland Clinic also notes that dry mouth is common in people with diabetes and high blood sugar. So if the tongue feels dry, fissured, or sticky all the time, that may be less about the tongue itself and more about hydration, medication load, blood sugar, and the mouth's protective barrier breaking down. The sixth sign is recurrent mouth sores or a sore tongue that keeps coming back along with digestive complaints. This is the part most people never hear. Mouth sores are not automatically a gut sign, but Mayo notes that canker sores can be associated with conditions such as celiac disease, Crohn's disease, and ulcerative colitis. Mayo also lists mouth sores among common symptoms of Crohn's disease, and NIDDK says celiac disease can affect more than just the gut by damaging the small intestine and interfering with nutrient absorption. In other words, if someone keeps getting recurrent mouth sores, tongue soreness, fatigue, bloating, diarrhea, constipation, or weight changes, it is worth thinking bigger than toothpaste or spicy food. Sometimes the mouth is the first place a broader inflammatory digestive pattern shows up. Now here is where all six signs connect. A sour taste points toward reflux. A smooth pale tongue points toward iron or B12 problems. Burning points toward deficiencies, reflux, or dry mouth. White patches point toward yeast overgrowth risk or high sugar environments. Dry cracking points toward dehydration, medication effects, or diabetes. Recurrent sores can overlap with inflammatory digestive disorders or nutrient problems. Different appearance, same lesson. The tongue is not separate from the digestive story. It often reflects what is happening with absorption, acid exposure, hydration, glycemic control, and mucosal health. This is why I would not tell someone to self-diagnose from the mirror. I would tell them to pay attention to patterns. Does the tongue change along with reflux, with bloating, with fatigue, with anemia, with diabetes, with a new medication list, with a long period of dry mouth? Because that is where the real value is, not in pretending the tongue can name the disease, but in recognizing that it may be signaling a body system under stress. And after 50, when medication burden rises and absorption problems become more common, those signals deserve more respect than most people give them. One more thing matters here. If the tongue change is persistent, painful, unexplained, or paired with trouble swallowing, weight loss, bleeding, major mouth pain, or ongoing sores that do not heal, that is not a wait-and-see forever situation. Mayo advises medical evaluation for large or persistent canker sores, and Mayo and NIDCR both note that dry mouth and tongue symptoms deserve professional assessment when they persist or become hard to explain. So if I had to reduce this whole topic to one line, it would be this. Your tongue is not diagnosing your gut, but it may be exposing the exact routine, deficiency, reflux pattern, or metabolic stress your gut has been trying to tell you about for months.